Friday, May the 14th, 2021. Here today speaking with the one and the only Mr. is Dr. Jon Lucas. How are you doing today, sir?
Good, thanks. How are you?
Doing just fine. Just staying busy. All the different things that are going on. With the events and stuff. A lot of events going on. Things are trying to get back to some level of normalcy and stuff like that. And so I'm very, very happy that you're back on with us. I might as well just say this up front. You have been so valuable to my promotions, and as a result of that, been so valuable to the fight community, whether it's kickboxing, boxing, MMA, in this region. Your advice and your guidance has been just so important to us and making sure that we were still able to continue our sports, but at the same time doing it as safely as possible. And I'm happy to report that we've done now 870 fights without any COVID issues. And so a lot of that, sir, is because I followed your guidance, your recommendations, and they worked. It wasn't a matter of being stupid about it. It wasn't a matter of just saying, oh, well, it doesn't exist, and stuff like that. It was that, yeah, it does exist, but if you do certain things based on your environment, you can be successful. So again, sir, thank you so much. I appreciate everything. I hope you like that award that we gave you. the cup. Now, where's that award sitting, sir?
That I'm not in my office. The picture is me standing in my office at work, but I'm home now. But it's sitting on my office. I have a couple of awards like that, a couple from you and a couple from Andrew Stokes.
Okay.
So it's funny. People walk into my office and look around, and they see diploma, a couple of jiu-jitsu belt certificates, and then there's a boxing belt and a couple of kickboxing trophies, and you get some weird looks.
I know, but it just really shows how valuable you are to our community over here. And again, I'm just very appreciative that you are on our team and have been on our team for many years. Okay, all right. So getting into this, as I have in the heading there, is it time to say goodbye to the mask? Right. I mean, and that is the big question. But before I have you answer that, we know that what the CDC said yesterday. So I want you to kind of sum all that up and answer that for us. Is it time?
Yeah. Like I told you last night, I kind of wish the CDC would have waited until Saturday to do that, or we had our talk on Wednesday.
That took our thunder.
Yeah. But so what the CDC said yesterday, and I say finally because myself and a lot of other physicians have felt pretty strongly about this increasingly for the past couple of weeks, that the data is starting to show pretty convincingly that just like every other immunization that we've ever had experience with, the COVID vaccinations, particularly the Pfizer vaccination and the BioNTech that are being used most predominantly in the United States, seem to confer not just immunity to the person who receives the vaccine and preventing them from getting severe disease, but there's pretty good data out of Israel in particular, and a little bit of anecdotal data from hospital systems that saw a tremendous decrease in the number of staff members who were getting COVID as they started getting vaccinated and got 2 weeks out from the second vaccine. But anyways, there's increasingly good data that the vaccine also prevents infection, period, and therefore transmission, or at least it prevents infection to the point where the person who would have potentially been infected but had the vaccine isn't going to be out spreading COVID to other people. So that was a very important distinction, because that makes the necessity, or the potential necessity, of someone who's fully immunized and is 2 weeks out from their second dose of the immunization, assuming they took one of the ones that requires 2 doses. It removes the necessity for that person to be wearing a mask, because they're not at significant personal risk for getting coronavirus because they've had the vaccine. And now we also see very good evidence that they're also not at risk for spreading it to other people. So under those circumstances, there's really no reason to encourage folks that have those immunizations to be wearing masks, other than some very specific circumstances, like at my work I work with kids that have pretty significant heart disease and they're at high risk for infection. So I doubt that they're going to remove the mask requirement for the physicians and nurses in hospital settings for quite a while, but that's very specific. But, go into the event that I'm going to tomorrow down in Myrtle Beach, just like the event I was at last weekend in Myrtle Beach. If you're in a outdoor environment, there's really good evidence that you're not at risk if you're immunized. And even on an indoor environment, unless you're packed together with people who have lots of symptoms or people that are at very, very high risk. If I was going to an event that was at a nursing home, I would feel a little different about that. But when you're with people who are younger, healthy, and in particular, now that the vaccine is available to such a broad spectrum of the population, people who either have been vaccinated or have chosen not to get vaccinated, and I think that's people's right to make that decision.
Right.
Then there's really no reason that you should feel compelled to have to wear a mask because your risk of spreading the disease to somebody else is very, very low if you've been immunized.
But since we cannot distinguish who's taken the vaccine and who hasn't, right? I mean, there's a lot of people just say, "Hey, I didn't want to wear a mask anyway," and they haven't been vaccinated. Perhaps they are, carrying the virus or whatever the case might be. How do we distinguish the difference, if we can even do that, or is this just an honor system that needs to be put in place? I guess.
Yes. I think the answer to that is we don't. We don't with any other disease, and I don't want to go too political with this discussion, but it's hard to not get political at some point because it's such a politically charged topic. But I think that in general, the public's responsibility to protect others is only present when there's a clear and present danger from an activity you're doing against somebody who has no way of defending themselves against that activity. That's like why you can't go to the store and fight your way to the front of the line, because that's not fair to other people. Right. But with COVID, especially now the vaccines are available, if you're vaccinated, then you're largely protected. So the risk of someone who's not wearing a mask and is potentially infected is really statistically very, very small. So it doesn't make, in my eyes, a lot of sense to have the entire population, including half the population now that's gotten vaccinated, wear masks to make you feel better that you can go out in public, even though your risk is very, very, very low. And on the flip side, somebody who decided they didn't want to get vaccinated. Now, again, there's some certain circumstances where someone might have wanted to get vaccinated but couldn't. Right. But if that's your situation, then you probably shouldn't be out in big public areas. Just like my heart transplant patients would probably love to come down and watch the boxing event tomorrow, but they don't because they can't afford to get a cold or, get sick. So they have to avoid those kind of settings. They wouldn't call Christy and say, "Hey, can you make everybody in the arena, wear a mask and stay away from me so I can come and watch that." So the risk to the general public from someone who's not wearing a mask, even if they're not vaccinated, is relatively small. It would be nice if people who have chosen not to get vaccinated would wear a mask when they're in big public settings, but I don't think that I don't waste any of my energy worrying about someone who's walking next to me. Man, that dude looks like he's probably anti-masker and hasn't gotten a vaccination. He could be out spreading COVID, unless he's, sweating profusely and hacking up a lung. And then just like anybody else who was doing that, I would avoid them. But I don't go through public areas.
I'm sorry. But even if he was, the vaccines, right, are supposed to protect us from him, correct?
Right. Mm-hmm. And they do that really well, but not perfectly, just like any other vaccine or any other treatment, so let's, we'll take, and I don't have all the statistics right in front of me, but let's say the vaccines are 90% effective at preventing you from contracting coronavirus and getting extremely sick. And especially if you're younger and healthy, your risk is already pretty low. And that's one of the things that's been frustrating about this whole pandemic is you keep hearing statistics get released, and as soon as a statistic gets released, it's immediately misinterpreted by one group or the other, and it oftentimes misinterpreted different ways by different groups to say something different. So like saying that the vaccine gives you a 90%, reduces your risk of infection by 90%, doesn't mean that you have a 10% chance of contracting coronavirus if you come in contact with it.
Right.
It means whatever your risk was, it's now 90% lower. So that's a big difference, because
that is a very big difference.
So suppose you and I are sitting, we're not doing this, from a couple hundred miles apart, doing it virtual. You and I are actually sitting next to each other in a table. And then you call me tomorrow and say, hey, you know what? I actually had coronavirus. I had my test on Wednesday. I was for sure infectious yesterday. Well, even if I wasn't vaccinated, my risk of getting coronavirus from you isn't 100%.
Right.
And then whatever that risk was, it's now 90% lower. So it's pretty low.
Right. And that's the whole idea, is that I've been, as a leader of my organization, where we do, a lot of fights across the country. My people are kind of waiting on me, right, to make the call about my events going forward. And I, again, wanted to have this conversation with you today before I made that call, just to feel a little bit more comfortable with it. And I think that where I'm going with it is more of an optional thing, as opposed to, you and I talked a long time ago, well, many times, and you've made the comment that nobody likes to be mandated to do anything, right? Even though I had to do it, based on what's been going on. But I think just like we were kind of like ahead of the game, if you will, by starting our events back in July of 2020 when everybody else is shut down, I want to kind of be at least on time, right, with taking the mask off and not mandating it. And so you're making me feel a lot more comfortable about making that call here, on at least by Monday.
Yeah, absolutely. Like I said, with the event that I'm going to tomorrow, I haven't talked to Christy about this at all, so I don't know what her plans are, but I would have no problem at all with her doing the exact same thing. And just like at Derek's event this past weekend, there were, as you know, from watching the feed and talking to the other Derek, there were quite a few.
There were 2 masks.
Yeah, there were 2 masks, right? Derek and his daughter. And then, when I left the room, I put a mask on, because that's different. If you're, we're in a room with 200 people and 198 of them don't have masks on, there's not really a point of me wearing a mask. It's not protecting me significantly. And I'm immunized, so I don't present a risk to the other folks. And they obviously don't care, or they would have a mask on. But when I walk out in the hotel, that's different, because the hotel had a mask requirement. They said they wanted you to wear a mask in public areas. And I don't want to hop on an elevator with somebody's grandma and make them nervous that I'm not following, the rule or whatnot. But inside the events and things like that, especially now that the CDC has said what they have said, I think that masks should be optional. If you're not comfortable not wearing a mask, then by all means wear a mask. I'm not going to make fun of you. I'm certainly not going to tell you can't. I mean, I think that would be ridiculous. But mandating it, I don't think there's any science to support that.
Right. Well, that's Chad Mueller there. He puts a big smiley face on it, because I have an event coming up in June 5th and 6th over in Missouri, where he and I was just having that discussion and everything, because over there, there's not a lot of masks being worn anyway. Right?
Yeah.
And so he's pretty happy probably to hear this.
And that's the thing, when you go to a fight sport event, regardless of the fight sport, with the possible exception of the really big events like the UFC. But I mean, if you go to the IKF, one of your events, or the World Classic, or you go to like the boxing event I'm going to, or a local MMA fight, somewhere around probably 75 to 90% of the people who are there train. Right. And I've trained at some point in probably every gym in North and South Carolina, or at least most of them in South Carolina. Right. And I know those folks pretty well. You and I both know that they're not wearing masks during training and whatnot. So the risk to these folks who are doing that, for 10 weeks, getting ready for a fight, and then wearing masks for 2 hours while they're at the actual event, that's really more political theater than it is protection. It's protecting the promoter and protecting the venue that the event is at from potential liability. But from a safety standpoint for preventing the spread of coronavirus, it's probably not making a huge difference. So I think that as the CDC was releasing that, people who are in my boat of, I don't think that these masks are making a significant difference, but I'll wear it because that's the rule and I don't want to make other people uncomfortable. As soon as the CDC said, you don't need to wear these outside, that was the last time I was ever putting a mask on it, like when I go to my son's track events and things
Right,
like
right,
that.
right, right.
Because, you know, the science for that has been very clear for a long time.
Right.
And then 5 minutes later, and there's like, oh, and by the way, if you're immunized and you're inside other than hospitals and places that mandate it for some other reason, you don't need to wear one. I thought, well, that makes my decision for the events I go to a lot easier, because instead of sitting there going, man, I hope I don't go to work on Monday and get called to the, you know, quote unquote principal's office saying,
Right.
hey, is this you at this event with no mask on? Because now there's, it's a lot easier to justify that, again, because I've been immunized and,
Right.
you know, I'm still following the quote unquote protocols.
Well, how are we doing as a country right now? Even though I know that, you know, the masks are moving forward, I can almost answer the question and say that we're doing okay. But in your opinion, as a doctor, how close are we moving towards that 70% immunity factor?
I think that's a really hard question to answer. So, you know, I think 70%, as far as people getting immunized, I'm not sure we're ever going to get there. This, you know, there's a pretty significant portion of the population that for one reason or the other is not interested in getting the vaccine. So I'm not sure that's, you know, that we're going to hit 70% from immunization. But on the other end of the spectrum, there's tons of people who have had COVID, both that have had tests for COVID, and there's probably a lot of people, especially younger, healthier people, AKA basically everybody that you deal with on a regular basis that's training and stuff like that, that could very well have had COVID and not known it. So the number of people who have gotten immunity, you know, for lack of a better term, in the wild by getting an infection
right.
is already high if you just take people who we know had COVID, and even higher, assuming that there's probably a significant number of people who had mildly symptomatic or asymptomatic infections, or they had symptoms and they're like, you know what, I'm just going to take the 14 days or whatever off work. There's no reason to have somebody go actually swab me to prove that I have it. So we're probably not super far away. And especially now that the Pfizer vaccine has been authorized to kids down to 12, you know, there's a lot of families who are very trepidatious about giving their kids vaccine, but there's also a lot of people who I think have been a little bit less vocal, particularly online, that have been praying for this day to come for a long time. So I've had a number of phone calls. I mean, it was within hours of that coming out that they were going to authorize it down to 12 from patients, families of mine who were like, how do we get this done? And the good news is, because the vaccine supply now is pretty significantly outstripping demand, if you decide you want to get a vaccination at 1:19 on, you know, Friday, you can get your first dose of the vaccine within an hour. It's no problem. You know, there's huge sites for all the major hospital systems through South Carolina. I'm sure it's the same in North Carolina. Might be a little bit harder in some places that were a little harder hit, like New York City or Los Angeles, but most places in the country, you can get it very, very quickly. So
you're seeing a demand already, because being a pediatric cardiologist, that I don't know whether you actually give shots, but you do deal with kids.
Yeah, we don't actually. The only immunizations we ever give in our office is we offer the flu vaccine, but we, you know, to administer the COVID vaccine, you have to go through a number of specific steps and whatnot. And I try very hard not to take over the task of being family's primary physician. You should have a primary physician, and that person should not be a subspecialist. It should really be a primary physician. That is a subspecialty all in of itself. But anyway, so the short answer to your question is no, we do not give the COVID shots in our office. But the hospitals, I work for Prisma, the Prisma Upstate and Prisma Midlands have very, very large vaccination sites that used to have significant lines when the older population was waiting for them to come out. But now, I mean, you can literally drive up. So like I have a son who turned 17 yesterday. As soon as he finishes states, he doesn't, for obvious reasons, since he throws, getting an injection in your shoulder just before you compete in states might not be the best idea in the world. But when he's done with that, yeah, he's gonna, you know, go and get his vaccine because it's something that he wants to do. He won't have to wait. He'll just, you know, get on my chart, make an appointment, and probably go an hour later, get it, and be done. So it's simple if you want it.
Right. Well, you know, I think that's great advice. But I want to, you know, Johnny Davis Live, real talk, real solutions. Right. You know, when I say that, I'm going somewhere. Right.
Yeah.
That I'm still a little confused. I've talked to people who are sick, who like other ailments, right? Diabetes or, whatever. And some people who are kind of okay, but they maybe might not be in the best shape. They have a big hesitancy to take the vaccine. Uh, you say that we might not reach the herd immunity factor based on vaccines only, but there might be an addition of the people who have already been infected, right? Who creates antibodies, I guess, right? And then there are people who will take the vaccine. That combined, it sounds like you're saying that we might then meet the 70%. My real question here is, why do you think that someone who is sick and scared to death of the COVID, and you are telling them as on a mountaintop screaming that the vaccine will prevent the virus, why do you think people would want to be, I'm going to call them the 30%ers, right? Meaning the people who just didn't give a darn, who are just going to wait on the 70%ers to try to, rid us of this thing. I mean, what do you think the mentality of that comes from, and what is that?
So, I mean, I think that there's a very broad range of reasons for that. Some of it is strictly political. People are far enough in one camp or the other that they're, kind of following the advice of the people in their little echo chamber that they follow. And then on the other hand, and this is something that's troubling, but unfortunately the cow is out of the horse is out of the barn, and this we can't do anything about it. Both the medical community and the government have so often in the past done things to violate the trust of the general public that I don't think we should be surprised a bit that when all of a sudden everybody's like, hey, we made this thing, it's safe, trust us, take it. Because I mean, there's people that their parents and grandparents were involved with the Tuskegee experiments. There's people that have had bad involvement with government from other standpoints. As you know, vaccine hesitancy in general, not just with the COVID vaccine, but vaccine hesitancy in general is not a rare thing. There's a lot of people out there. It's not a substantial portion of the population, but it's not insignificant either, right, who are very hesitant about getting vaccinated at all. So when the new COVID vaccine popped up, I think it pushed all those buttons simultaneously, and the vaccine hesitant crowd was very vocal about, man, we don't want to do this. What's been kind of odd, and again, to kind of veer into politics for a second, to me was, the vaccine was created sort of under the Trump administration. And I think largely because of that, when the election hadn't happened yet, there was people who were kind of far left saying, well, we're never getting a vaccine that Trump came up with because it might, I don't know, make us turn into conservative racists or something. That changed some way in there. And then all of a sudden, now that Biden is in, now all of a sudden it's the opposite. There's a lot of people that I see, at least what I see online and kind of hear in rumblings. And of course, living in the deep South in South Carolina, I tend to get more strongly conservative voices in my ear than I do people who are real far to the left. Sure. But they're hesitant because now it's Biden saying that you should do this. And there was somebody in his administration who specifically said she would never get a shot that Trump supported, and now is trying to go back on that. And that kind of duplicity where you say one thing and do something different, and I'm looking at you, Dr. Fauci, from that, makes it really hard to take people seriously. When you come out and say you should do X, and then a month or so later you're saying, well, I just said that because we were trying to get people to do such and such, but what I really want is this. Yeah. I mean, anybody who has kids knows that doesn't work. And it's really, I've tried to stop using the term leader to refer to our government and refer to them as the government, because that's what we really were missing through this whole thing is leadership. Somebody who would say, this is what we know now, and this may change, but based on the best evidence, I would do X, without putting it through some sort of political filter first. And that kind of mixed messaging has really been confusing to everyone. And I think it's really the underpinning for why vaccine hesitancy is so prevalent, because there have been so many times that people have said one thing and done something different. Right.
But we've had, like I said, a huge amount of deaths due to the COVID. And I'm curious, that where are we right now with the deaths in the sense that, people are still dying, right? So has that number dropped below a certain barometer that we can feel comfortable in taking the mask off, for example?
Yeah, I think that number depends on who you ask. So there's, some parts of the population that never were uncomfortable with, even when we were having 3,000 deaths a day, they're like, but it's
Right.
mostly people who are 80 years old and
Yeah.
obese and whatnot. So, I guess that's their opinion, but that still seems like an awful lot of people. And then on the other hand, there's people who seem like that they're not going to feel comfortable taking a mask off until the death rate from anything is zero. And that's not really a rational position either. So looking at where we're at from a death rate, and more importantly, who's getting the infection, because again, statistics are helpful, but they can be interpreted a number of different ways. So one of the things that I was having a discussion with somebody earlier today, and they were saying, well, I'm really concerned that 20% of the current COVID infections are people who are less than 18. And I was like, I wish 100% of the current COVID infections are people who are less than 18, because what's happening is not that kids are getting COVID more often. It's that people who are older are getting COVID way less. So the 18 and under population is making up a bigger percentage of that. And because the 18 and under population is at such a lower risk statistically for severe disease and death, the death rate is falling. I don't think we've had a day where we've had more than 1,000 people die of COVID for a couple of weeks now.
Wow.
And our 5 to 7 day running average is like around 600 or 700 deaths, which is still 600 or 700 too many.
Yes.
But it wasn't that long ago that every day that number was going up by 3,000 or more.
Oh, yeah. Oh, yeah. It was absolutely crazy. So what do you think about just like the measles mandates? For kids getting back in school, they have to take a certain shot. All of us have to do it. What do you think, at least for precautionary reasons, to get schools open again, which I think they could be open right now, but to get them open again and make people feel a little bit more safe, that there was a mandate to get the COVID vaccine, since now we're doing kids?
Yeah. So, I'm not a big fan of mandates, period.
Right.
There's not very many. And the only situation where I think mandates are appropriate from a medical standpoint is when there's something that somebody would do that would put a significant risk on other folks that they didn't have any control over. And especially for kids, we know a couple of things. So one, there's lots of schools around the country that never shut in the first place. My kid's school is one of them.
Sure.
They've been going to school, right? I mean, I think there was a week or two where they didn't go to school.
Out of fairness, though, and also some baselines there for economics.
Yeah.
Certain areas.
Yeah, for sure. But the point that I was getting at was there's pretty good data available that schools are not a significant mode of transmission, which is confusing, because if what they said about COVID and other situations is all true, you would expect that would be the case, but it doesn't seem like that it is. 2, teachers were 1A for the vaccine. So anybody who teaches school that wants the vaccine should have got it now. If you're teaching and you haven't gotten the vaccine, it's either because you don't want it or you're one of the rare individuals that has a specific contraindication, but the majority of teachers should be able to get it.
Right.
And then 3, kids are at a low risk of getting significant disease from COVID and at a very low risk of dying from COVID. So if you were to mandate kids get the COVID vaccine, what you'd be saying is that I want you to accept the risk, which is admittedly very, very small statistically from what we've seen so far. But I want you to accept the risk of this vaccine for something that doesn't present a significant risk to you, to potentially prevent you from spreading it to someone who could have gotten the vaccine themselves, to keep them from getting sick. I don't think that's going to fly. It's certainly not going to fly here in the Deep South.
Yeah, well, I know that a lot of places have these assumption of the risk torts and stuff, and or consent and release forms. Should that be something that should be implemented if you refuse to get the vaccine?
Yeah, I don't know. I guess that's something. I mean, you have to have a attorney on to address those issues. I really don't know from my standpoint. From the sort of geopolitical standpoint, I have control over one person, total control over one person, in pretty good control over 3 others, being my wife and my 2 kids. So I can give them advice and they take that reasonably seriously. But I mean, I wouldn't, if Thomas had the other option, he was like, you know what, I don't want the vaccine. I don't care what you say. I don't care that you went to medical school. I think it's, you know, a huge risk. I'm not going to try to hold him down and make him get the vaccine.
Right.
The fact that he's bigger than me has nothing to do with it. From a, you know, from an intellectual standpoint. And the same thing with my daughter. She's younger. She's 14. If she decided she didn't want to get the vaccine, I would try to convince her. But I mean, it's not a red line in the sand for me. So in the same thing, I have a very large number of patients, families who have very specifically said they have no intent of getting the vaccine. Okay. That's fine. From a scientific standpoint, I disagree with your assessment, but that's not, you know, I'm not going to say I'm not going to see you as a physician. I'm not going to not let you come to the practice. I'm not going to make you take other precautions. I mean, that's your right as a human being, I think, to make that decision. Sure. I think what the scientific community needs to focus on is coming up with better, not even arguments, but better explanations and better descriptions of the science, and more importantly, consistency with what they say and what they do, not mandates. The way to get people to do what you want them to do is with carrots, not with sticks. Sticks may work short term, but they don't work long term. And the problem is, once you use a stick, it works, it becomes the go-to. You know, I don't know if you've ever raised animals, but if you have a beast of burden that you're trying to get to do something, the way to really teach the ox how to pull the plow is to teach it that pulling the plow is not that big of a deal. And when he's done doing it, he gets, you know, a bath, or, you know, gets a sugar gum bag or something like that. Right. But on the other hand, the fastest way to get him to pull the plow is to stand behind him and beat on him with a stick or hit him with a cattle prod. But once you do that, anytime you want him to do anything, that's going to seem like the go-to. And that's I'm not generally a fan of using the slippery slope argument, but that's definitely a slippery slope. Right. If we start mandating COVID vaccines, there's tons of other things from a medical standpoint that could be mandated. I mean, including banning the sale of cigarettes, banning the sale of alcohol, banning the sale of most energy drinks, mandating the flu vaccine, any other vaccine you can think of. You know, should we make everybody work out for at least 30 minutes a day? Who's going to monitor that? Right. You know, there's tons of things that could potentially be mandated that you could come up with just as strong statistical evidence as mandating the COVID vaccine. So from where I sit, from a medical standpoint, and I would argue from a political standpoint, the best way to do that would be to continue preaching the same consistent message of this is the data we have about the vaccine, and then addressing people's concerns, you know, like infertility. Well, there's rumors going around that the vaccine causes infertility. There's no evidence to support that now. So you can sit down and talk with people and show them this is what the data shows. This is how much of the general population has problems with fertility. This is how much of the people who have been vaccinated have had problems with infertility. They're not statistically different. So there's no reason to suspect the vaccine is causing that. And, you know, that kind of thing, instead of saying, well, you know what, I don't want to talk to you about that. We're just going to make you get it because I said so. That's probably not going to work well. Right.
I'm just kind of sitting here thinking as I'm listening to you that even though, you know, we're getting a little ease on the mask wearing, I got a feeling a lot of people are still going to be wearing masks for especially the foreseeable future, especially in the wintertime. I just wanted to kind of digress and go back to that, because as I'm sitting here thinking, I can think of a lot of situations where I'm going to continue to wear my mask. And I think it'd probably be, you know, other people that's going to be doing that just to feel a little bit safer. What are your thoughts on that?
I think that that's probably very true. And that was, you know, I was a little surprised, I have to admit, yesterday when the CDC made their announcement, and then I read it on the WYFF, which is one of our local news stations, Facebook page. And there was, you know, already like 2,000 or 3,000 comments about it. And I expected every comment to be, you know, thank God, this has been coming forever. But that was not the case at all. A good 2/3 of the comments are people going, oh, this is too soon. You know, this is going to cause all sorts of deaths. And I was very, very surprised at that, because there's, you know, there's clearly no data to support that position. And I think people who have that tendency, in particular areas of the country a little harder hit, specifically around the New York metropolitan area, I think you'll see mask wearing is going to be pretty common. In fact, I would, like if you walk downtown Simpsonville, where I'm sitting today, without a mask on, no one's going to say anything to you. In fact, it's more likely if I walk out of a store with a mask on, someone's going to say, "Hey, dude, you know that the government said you don't have to wear that outside anymore." But if I could click my heels together in a pier in, downtown Manhattan or someplace like that, that was really heavily hit with coronavirus, particularly early on, I'll bet there's still going to be a tremendous amount of social pressure to continue masking. It'll be interesting to see how that plays out.
Yeah, as I wind down here, what I kind of feel like? I was happy to hear about the mask, the mandates and all that kind of coming out. But you know what I kind of feel like? I kind of feel like a kid that's been in timeout because I did something wrong and I was really punished badly during the COVID-19. And it was like when there was such a relief from when they said that, okay, it's like we're moving forward. Like we've really made some grounds here and defeating this virus. And there's a big relief inside that, maybe some of the things we finally started getting right. But I do feel a little punished, if you will, based on how bad it beat us up, especially in this country. Is that something I should feel? Or do you think other people are feeling kind of like that as well, Doc?
I think very much so. I think everybody should definitely feel relief, not even just so much about not having to wear a mask, but just there's very convincing data that the country is in a much better place. I mean, a tremendously better place with regards to the pandemic than it was a month or two ago. There's a number of things that have happened that are really, really encouraging and probably not explainable just by the fact that we're moving out of cough, cold, and flu season into the summer. The vaccination rates, the fact that a lot of very high-risk populations in dense urban centers like New York City, LA, that had soaring numbers a couple of months ago, or 3, 4, 5 months ago, have their numbers falling, is really suggesting that we have turned an important corner in this. There's still some risks. I mean, it's definitely possible that the coronavirus, especially if it continues to simmer at a low but not imperceptible rate, we could have some variants pop up that suddenly the vaccine isn't effective against, and we see rates jump back up, and then we'll have a significant problem. But that hasn't happened yet. And because that hasn't happened yet, every day that goes by and a bunch more people get immunized, and a couple of people in the area get immunity from having contracted the virus and things like that, the risk for that sort of thing to happen goes down and down and down and down. And it's been clearly falling statistically for a while. So we're definitely in a better place. So we should feel better about that.
Right. Well, I feel better about having you on our team, sir. This has been fantastic. And again, I'm just very, very grateful for all of the things that you've done for us and will continue to do. You're not going anywhere unless
for sure.
You become the chief physician for the state of South Carolina, which I can absolutely see. Because you're so intelligent, and to me, you're level-headed. That's the thing that I like about you, Doc. That you don't tilt so much to one side or the other. You just kind of look at it from a common sense type of an approach, if you will. And that is why I think that more people should get to know who you are and what you do. In my opinion, the governors and all of that need to contact you, Dr. Jon Lucas. I'm serious, and have a really serious openness, because I know there's other intelligent doctors out there, but sometimes they are too locked into their politics to give a really true and honest answer based on what they know as correct or what they've learned as far as they politicize it. You've not done that. Through all of the times that I've had you on this show, all of your comments are really very just level, and people can kind of grab from either side. There's kind of a neutral kind of comment, if you will. that to me is so valuable, sir, and I'm so appreciative for all of your contributions. Again, and one of these days I'm going to have to come to that office and see that cup that we gave you. Make sure it's up there and not in the trash somewhere, you know, and stuff like that. Any final thoughts, Doc?
No, I think that's pretty much it. Look, it's, as you know, in South Carolina in particular, the fight scene has been really starting to fire on all cylinders. We've got a number of MMA promotions going, got a big pro boxing event that Christy Martin's putting on tomorrow down in Myrtle Beach. You're doing PKBs, it seems like 8 days a week now, so it's really nice to see that, that community starting to fire back up. Gyms are getting busy again. So it's really it feels like things are starting to kind of get back to normal inside the fight community. And I hope that our neighboring states, particularly North Carolina, can join us in that in the near future.
Yeah, they definitely. I'm hoping that as well, and we're able to do the PKBs, but they still don't have the commission intact there. I got some bigger things that I'm working on too, Doc. I'll be in touch with you, of course. Got to keep moving up to that next level, right?
Yep.
But Doc, thanks so much for all you have done and all you will do and will continue to do for us. Thanks so much, sir.
Thanks, Johnny.
I'll see you soon. Bye-bye. All right, ladies and gentlemen, there you have it. They're speaking with Dr. Jon Lucas. I just want to remind everyone that, he has just been such a valuable source for us again, and he's someone that you can depend on and rely on for great information. I want to thank him so much for being on today. I want to remind those who will come on our next show coming up at 2 o'clock regarding the passing of crew Rick Davis. We put a link out there, a public link. And if you came on a little early, which I saw some of you did, to make comment, you need to do that at 2, a little bit after 2 o'clock, and you need to hang in there in our virtual lobby, where we will then call you up when it's your turn, if you will, if you want to make comment. All right, guys, that's all I have for you today for this first edition of Johnny Davis Live. Again, I'm still recommending that everybody get those vaccinations. Treat everybody with respect, and always forward march. This is Johnny Davis Live, and I'm checking out. Talk to you soon.